while they are receiving the medication, we can actually put a cooling cap on the patient's head, and this is cooled to a very low temperature. It reduces the amount of blood going to the scalp, and it actually reduces the hair loss by up to 78%.
Halo sahabat semuanya, welcome to Bincang-Bincang. Hari ini saya bersama lagi dengan Dr. Thomas Soh, seorang spesialis onkologi di Gleneagles Hospital Singapura. Kita akan bahas topik menarik, judulnya apakah kemoterapi selalu mengakibatkan rontok rambut? Tapi sebelumnya, perkenalkan saya Dr. Tony Setiobudi, spesialis bedah tulang di Mount Elizabeth Hospital Singapura. Di bincang-bincang ini, kita ingin meluruskan misinformasi, misconception, dan hoax tentang medis yang terutama yang beredar di masyarakat. Dan kita tanyakan langsung ke ahlinya. Okay, Thomas, you are an oncologist, and obviously you have a lot of experience using different modalities to treat cancer, including chemotherapy. Hair loss is one of the common concerns of people who suffer from cancer. So my question to you today is, does chemotherapy always cause hair loss? Okay, Thomas, time is yours.
Okay, to directly answer your question, all right, it does not always result in hair loss. To probably clarify a misconception, okay, chemotherapy is not the only way to treat cancer. In fact, for most early stages of cancer, the main treatment is actually surgery. For intermediate stage of cancer, it is usually a combination of surgery, maybe with chemotherapy, right, and radiotherapy. In advanced stages, meaning to say if the cancer has spread, right, to other parts of the body, the usual treatment is chemotherapy traditionally, but more and more now we have other ways of treatment, such as targeted therapy, immunotherapy, and there is also radiotherapy. So chemotherapy is not the only way, yes, and it does not always result in hair loss.
Can I just ask you, how does chemotherapy lead to hair loss? Can you explain?
So generally, chemotherapy targets actively dividing cells. It has a preference to kill cancer cells because cancer cells are actively dividing. Yes, but chemotherapy is not selective. So chemotherapy does kill normal cells as well. And in particular, the so-called normal cells that are at risk are cells that are actively dividing. So you do get changes in your skin, very commonly. You do get changes in your nails, you get changes such as ulcers, because all these are actively dividing cells, right, that always have to regenerate. And of course, the hair, right? The hair is growing. Our hair is growing all the time. And therefore, it is also, all right, a target for chemotherapy to actually affect its growth.
Right. I think because we see what we can see, we don't see what is inside, but chemotherapy does have a side effect in the gastrointestinal system, but we cannot see that. But we can see hair loss. So people are very concerned about that. You are mentioning that some chemotherapy does not cause hair loss. What makes the difference?
I would say just the difference in the way certain chemotherapy works. Different drugs target different parts of the cell cycle. Yes. The cell divides in a certain way. Different chemotherapies target different parts of the cell cycle differently. But in general, anti-microtubule drugs, they do cause hair loss. Anti-metabolites, which is basically the building blocks of, say, DNA or RNA, which certain chemotherapy interrupts, these generally do not cause hair loss. But again, it is just examples, yeah?
And is this medication or chemotherapy used for certain type of cancer, or this is applicable to all types of cancer?
I would say that we use different classes of chemotherapy for all different classes of cancer. All right.
All right.
There are some chemotherapy drugs that work better for certain cancers. For example, in colorectal cancer, yes, for the early and intermediate stages, where we use this medication called 5-FU, and also we use commonly this medication called oxaliplatin. These generally do not cause hair loss, but it does not mean that all chemotherapy for colon cancer do not cause hair loss. There are medications that also cause hair loss that we sometimes use for colon cancer.
Okay, just to give us some idea, how many percent do you think chemotherapy drug cause hair loss, and how many percent doesn't cause hair loss?
I don't think there's a fixed percentage, Tony. But for example, if we are talking about colorectal cancer, then majority of the drugs do not cause hair loss. I would say that 80% of the medications do not cause hair loss. Whereas if you look at breast cancer, most of the medications actually cause hair loss. When we use the medication, it's the effectiveness which is the first consideration rather than whether or not it causes hair loss or not.
Okay, Thomas, for some chemotherapy that causes hair loss, is there anything that you can do to minimize the amount of hair loss to the patient?
Oh, that's a very good question, Tony. So even for medications that we know that usually cause hair loss, there are now certain devices that we can use when the patient receives the chemotherapy to reduce the percentage of hair loss. Yeah.
Okay.
So when patients get these chemotherapy medications, while they are receiving the medication, we can actually put a cooling cap on the patient's head. All right. And this is cooled to a very low temperature. And what happens is it reduces the amount of blood going to the scalp. And therefore, it also reduces the amount of chemotherapy that goes to the hair cells. Right? And it actually reduces the hair loss, right, by up to 70-80%.
Okay. Yeah? Do you put this during chemotherapy session, or you need to put it on after that as well?
So it's actually put on before, during, and a short duration after.
Can you give me some idea, like how many hours before and how many hours after?
So generally about half an hour before, to an hour before, and half an hour to an hour after. So it does lead to the whole treatment being slightly longer, but most patients feel that it's worth it. The drugs are not immediately cleared from the system, and therefore cooling caps do not reduce the incidence of hair loss by 100%.
Okay.
Yes, but it does actually help prevent the maximal concentration exposure, which is actually during the infusion itself.
Yeah. Okay. That is very interesting and fascinating. I never heard about this cooling cap. So it's something new for me as well. So back to the original question, chemotherapy causes hair loss. Is it always? The answer is no. But if the chemotherapy does cause hair loss and the patient needs it, you can put cooling cap to reduce the amount of hair loss. Right, Thomas?
Yes, that's right.
Alright, thank you so much, Thomas, for your time today. Kita semua sudah belajar banyak, saya sendiri belajar banyak tentang cooling cap, nggak pernah dengar sebelumnya. Bagi pemirsa, silahkan tulis komen dan pertanyaan di bawah ini, dan jangan lupa subscribe, like, dan share video ini, dan sampai jumpa di bincang-bincang berikutnya. Bye-bye.